What cultural differences impact daily cystic fibrosis care? Imagine waking up every day with a complex health routine that needs to be followed precisely. Now imagine doing that while navigating different cultural beliefs, language barriers, and healthcare systems. Cultural differences play a big role in how people with cystic fibrosis manage their daily routines, stay healthy, and feel supported. Cystic fibrosis is caused by mutations in the CFTR gene, and these mutations vary among different ethnic groups. For example, some mutations are more common in Caucasian populations, while others are found more often in minority groups. This genetic diversity affects how doctors diagnose and treat the condition because some therapies are designed to target specific mutations. Knowing this helps healthcare providers personalize care for each patient. Unfortunately, minority populations such as Black, Hispanic, or Asian communities often experience delays in diagnosis. This can happen because healthcare providers might not immediately suspect cystic fibrosis in these groups, mistakenly thinking it mainly affects Caucasians. When diagnosis is delayed, it can lead to worse health outcomes and make managing daily routines more challenging. Cultural beliefs about illness and treatment also influence how families approach cystic fibrosis care. Some cultures may have traditional health practices or different views on medication and therapy. Language barriers and varying levels of health literacy can make it harder for patients and families to understand and stick to complex treatment plans like airway clearance techniques, medication schedules, or nutritional support. Tailoring education to fit cultural contexts and using interpreters when needed can improve understanding and adherence. The relationship between patients and healthcare providers is another key factor. Cultural differences can influence communication styles, expectations, and trust. For example, some cultures may prefer more formal interactions or have different attitudes toward authority figures. When providers understand these nuances, they can build stronger relationships, which encourages patients to follow their daily routines more consistently. Access to healthcare resources is often linked to cultural and socioeconomic factors. Minority groups may face barriers like limited insurance, transportation issues, or a lack of culturally sensitive care. These obstacles can make it harder to get regular treatments, attend appointments, or access support services, all of which are vital for managing cystic fibrosis daily. Mental health and social support are also shaped by culture. Some communities may have stigma around chronic illness, which can affect emotional well-being and motivation to maintain daily care routines. Family dynamics and community support vary widely and influence how patients cope with their condition. Recognizing these cultural norms helps healthcare teams provide holistic support that includes mental health and social needs. To improve daily cystic fibrosis care across different cultures, healthcare providers should offer education that respects cultural backgrounds and languages. They should be aware of the possibility of cystic fibrosis in all ethnic groups to avoid missed or delayed diagnoses. Building open, respectful communication that considers cultural values helps foster trust. Addressing socioeconomic barriers ensures all patients have access to necessary treatments and support. Supporting mental health within each cultural context is equally important. By understanding and respecting cultural differences, healthcare teams can help patients stick to their routines, feel more satisfied with their care, and achieve better health outcomes. Every person's experience with cystic fibrosis is unique, and embracing that diversity is key to providing the best possible support.